The Boston Assessment for Severe Aphasia is a diagnostic tool designed to be given to post-stroke patients soon after the onset of their symptoms, preferably at their bedside. There's no age range for this test, so anyone who suffers from a severe stroke can be given this assessment. It can be given long before most other assessments are appropriate. The BASA evaluates the spared language abilities of persons with severe aphasia and provides diagnostic information needed for immediate treatment. Specifically, this test is designed to quickly identify the preserved skills of the patient with severe or global aphasia. Good afternoon.
Ba.
Are you Mrs. Barretto?
Ba.
My name is Emma. I'm a speech-language pathologist, and your doctor has asked me to talk with you and see how you are coming along. How are you feeling today?
Yeah.
Did you say you had a stroke?
Ba.
Did you have a heart attack?
Ba.
Is this Our Lady of the Lake?
Yeah.
Is this St. Joe's Medical Center?
Yeah.
Okay. I was wondering how old you are. Are you 80 years old?
Ba.
Are you 60 years old?
Yeah.
Okay, awesome. I was wondering where you live. Do you live in Missouri?
Ba.
Do you live in Louisiana?
Ba.
Okay. Now I'm going to use some calendar cards that I want you to look at. Okay. What month is it now? Okay. What part of the month are we in? Near the beginning, the middle, or the end?
End.
Okay. All right, awesome. You're working really hard. Okay. Now I want you to do what I tell you. Close your eyes. Open your mouth. Show me your teeth. Stick out your tongue. Now I want you to take a deep breath and say ah and hold it until I tell you to stop. Stop. Great. Okay. I want you to say what I say. No.
No.
Money.
Ba.
Pizza.
Ba.
I love you.
Ba 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 ba.
Why not?
Ba ba ba.
Okay, awesome. Now I want you to say ba.
Ba.
Great. Okay, we're going to keep moving on. Okay, now I'd like you to do something with your arm and hand. Show me how you salute or pledge allegiance to the flag. Show me how you shake your finger at a naughty child. Okay, awesome. Now we are going to look at some numbers. Okay. Point to the number 2. Point to 0. Great. Okay, now we're done with those. Okay, now we're going to look at some pictures. Which picture shows this? Sleeping gesture. Drinking gesture.
Which one shows sleeping? Which one shows drinking? Okay, great, you're listening very well. Okay, now we're going to look at a card with some printed words on it. Which word goes with this? Person talking on the telephone. Person sleeping in bed. Okay. We're almost done. Okay, now I'm going to have you draw a picture of a man, and I want you to draw a picture of a man. Okay, I'm going to remove the picture. Oh, okay, great. I'll take that. Okay, now we made it to the end of the assessment. This says that you finished the test and you understand the test results will be better used to plan your rehabilitation program. Please sign your name on the dotted line. Great, now we're done the assessment. You worked really hard and I cannot wait to see you next session. Goodbye.
What you just saw was a modified administration of the Boston Assessment of Severe Aphasia. We chose a few items from each cluster in the assessment to demonstrate what it would look like if you would need to perform this particular test. When scoring the BASA, there is a gestural or a verbal column. So in the record form, if you can see, there is the G, and that means gestural, and then there's the V, and that's where it means verbal responses. And located on the handout, you will find how to distinguish the communicative quality of gestural and verbal. To calculate the BASA total raw score, first you need to sum the item cluster raw scores. You will do this by counting the items circled by the clinician that was providing the assessment and divide the total possible points. The clusters are auditory comprehension, praxis, oral gestural expression, reading comprehension, and others. The cluster named Other includes gestural recognition, writing, and visuospatial tasks. Each cluster contributes equally to the BASA total score. So, the total raw score is equal to the sum of the raw scores of the 5 item clusters that I just talked about. You must convert the raw score to a standard score by using the tables located in the manual. The standard scores are able to be converted into percentile ranks. To obtain the percentile rank, you use the standard score from each cluster. So this is the manual for the BASA, and located in the back are all the norm tables. And so first they have a norm table for global aphasia, and it includes each cluster in the middle, and then they have the raw score that you found, and in the middle is the standardized scores for each cluster. And then right behind it, they also have raw scores for severe aphasia as well. And it's the same thing. The standard scores are in the middle and the raw scores are on the outside. And then to be able to convert them to a percentile rank, you go to the other norm table, and each standard score, you know, they have one column of the standard scores, but you use each standard score that you got from each cluster from the norm tables that I previously talked about. So then they have the standard score and the percentile rank, and that's what you use to obtain the percentile rank.